Hi, my name is Erin Kenney, and I am a first-year MPH student at the University of Arizona. This past year, my undergraduate internship was through the Mel and Enid Zuckerman College of Public Health Academic Health Department. Due to the pandemic, my internship was entirely virtual, and all of my meetings were conducted via Zoom. I started with the Academic Health Department in January of 2021 and ended in August of 2021 after spending over 260 hours on various projects. My preceptor was Laura Grunwald, and my site supervisor, who helped me grow tremendously throughout my journey, was Emily Waldron. The Mezcoff Academic Health Department is a bridge between the faculty at the University of Arizona and local health departments. Emily Waldron, my site supervisor, was a key individual in connecting the interns of the Academic Health Department, faculty at the university, and local health department staff. Interns for the AHD had various roles and were based on the needs of different county health departments in Arizona or faculty requests. University of Arizona faculty had an abundance of research that can be used to inform communities, and the connections established from the AHD were meant to link faculty and health departments for future endeavors. My main role as an intern was to create culturally competent, visually appealing graphics that met the needs of those that requested them. For my internship, I completed an array of projects, but I developed a few main goals and objectives to summarize what I intended to complete. My first goal was to lead communication graphic efforts between Mezcoff, Pinal County Health Department, and Pinal County Schools, which ultimately led to the Pinal County School Health webinar on COVID-19 being developed. My second goal was to partner with Mezcoff health departments and the Public Health Foundation. The Public Health Foundation put on a webinar about the University of Arizona Academic Health Department and focused on COVID-19 response among the interns. My final goal was to collaborate with Graham County Health Department to establish and update health resources for seniors in the county, which ultimately resulted in a senior resource guide. In order to complete these goals and objectives, a similar format was followed for each of my projects. First, I would discuss a project or task with my site supervisor, and then I would set up meetings with those that requested the project. Typically, these meetings would include faculty, health department staff, other AHD interns, or any other individuals that were part of their respective project. In the beginning stages, we would discuss what the project was, who the intended audience was, and any other expectations that the health departments or faculty had. In order to adequately create the graphics, all of these questions were crucial parts of communication. From there, I would use a platform called Canva to create my graphics, as this platform provided me with a variety of elements to be successful. After I completed a graphic, I would send it to my site supervisor for revisions and make any edits she gave me. Then I would send the draft to the original requester or requesters of the graphic for any of their final edits. Another task I would have is to send the graphic to a Spanish-speaking AHD intern and then translate the graphic based on their translation notes. To evaluate my progress, I had 4 evaluations throughout the course of my internship to review how I was doing. At the end of my internship, I had created over 40 graphics for various health departments and university faculty members. I also participated in 2 public health webinars, which helped me in developing professional communication and collaboration skills. Through the AHD Public Health Foundation webinar, the intern team was able to show the benefits of the academic health department to local communities and what resources an AHD has to offer. Another project I completed was the Senior Resource Guide for Graham County, which increased access to health resources for individuals 65 years and older. I performed Essential Public Health Service number 3, which is to communicate effectively to inform and educate people about health, factors that influence it, and how to improve it. This was done through my various projects and graphics for local communities. Here are some examples of graphics that I completed throughout my internship. The first graphic was originally done for a faculty member at the University of Arizona and then formatted to fit the colors of La Paz County. The second graphic pertains to quarantining and COVID-19, which was for Pinal County and the school health webinar. The third graphic was translated to Spanish and then reformatted to fit the colors of Pima County after I originally made it for another health department. On this slide, the first graphic was for Cochise County and was aimed to increase vaccination rates among the population. The second graphic was a template I made on the difference between COVID-19 and allergies. This graphic was then reformatted to fit the colors of different Arizona County health departments. The third graphic was for Pinal County and was also used in the school health webinar. Through my internship, I've gained real-world public health experience and continuously improved my graphic design skills. I was able to see firsthand how public health ordinances are constantly changing, which meant I was updating my COVID-19 graphics to relate the most accurate information. In regard to COVID-19 mitigation efforts, my graphics were intended to increase vaccination rates and reduce the spread of misinformation. The senior resource guide allowed me to understand health resources for a certain population and why updating resources is important. Through all my projects, I was able to gain collaborative skills by working with public health officials, university faculty, and other AHD interns. I would like to take a moment to thank Emily Waldron, Laura Grunwald, and Aiden Grijalva. Aiden co-developed the Pinal County School Health webinar with me and translated the majority of my graphics. I'd also like to thank all of the health department staff that I worked with in Pinal, Cochise, Pima, La Paz, and Graham County, as well as the University of Arizona faculty that provided me with research. Finally, this internship was funded by the Western Region Public Health Training Center, and I'm forever grateful for the public health knowledge that I gained from this experience. Thanks so much for listening.